see, as there may still be other people joining, but thank you guys all for being here. I'm gonna get us started just with some introductions. And actually, even before I do that, Tate and Bryn, if you guys wouldn't mind just introducing yourselves, we'd love just to know who you, yeah, just a brief intro. Thanks.
Sure. I'm Tate. I'm a legislative aide for Senator Wiener, who's the lead author of this bill. As mentioned, I focus on energy, environmental, and transportation issues for the senator. Please, let me know if you have any questions or reach out. Amanda has my email. I'm more than willing to set up any conversations with any of you. And pass it to Bryn.
Hi, I'm Bryn. I'm a leg aide in Senator and Senator Gonzalez is very interested in the topic area of fracking and other environmental justice concerns. So I'm just here to listen and learn as much as I can. And I'm the staffer for environmental quality, and the senator sits on environmental quality committee. Happy to be here.
Okay. And I see Dylan just joined as well. Dylan, I don't know if you can hear us, but if you can, do you mind just giving a brief introduction? That may or may not have gone through. Okay, well, Dylan, if you have a second to unmute, we'd love to hear who you are, but we'll keep going in the meantime. Alrighty, well, thank you all for being here. I'm just gonna give a brief overview of what we are all here for today, and then we'll get to our main presentation. My name, for those of you who don't know, is Amanda Milstein. I'm a primary care pediatrician in Richmond, California, and I'm a co-founder of an organization called Climate Health Now. We are a group of more than 460 medical professionals and students across California who recognize climate change as the health and equity emergency of our lifetime, and who are organizing to use our trusted health voices to achieve a rapid, just transition off of fossil fuels to a healthy and equitable society that is sustained by renewable energy. Thank you so much to Tate, Hannah, and Senator Wiener's office for giving us the opportunity to speak today. As you will hear shortly from our presenters, the health consequences of fracking and oil and gas extraction generally are myriad and severe. If there is one thing we'd like for you to take from our presentation today, it is this: fracking is incompatible with health. It is with honor that I introduce our two presenters for the day, Dr. Wendy Ring and Dr. Jeff Mann. Dr. Ring is a retired family physician and public health professional. She is the founder and prior medical director of a federally qualified health center on wheels in Humboldt County. Dr. Mann is an orthopedic surgeon who has been practicing in Oakland for 25 years. Both Doctors Ring and Mann have been members of Climate Health Now from the start. With that, I will turn to Dr. Ring to get us started. I'm just gonna share my screen. Alrighty, can you all see that?
Yes, I can see it.
Alrighty, Wendy, we're gonna kick it off.
So we are going to be focusing on health impacts in a particular place and on a particular group of people. So, so my job initially is going to be to set the scene. We're going to be talking about air pollution, water contamination, the specific health risks associated with intensive oil extraction, and the environmental justice issues that result. So this is a map of well permits issued in the last 5 years. And the red dots are wells that are within a half a mile of homes. The yellow dots are more distant wells, and the orange squares are permits for well stimulation. And you can see that they're mostly in Kern County. The cyclic steam permits don't appear, but they would be clustered in Kern as well. Slide. This is a picture from Kern County's Midway Sunset oil field back in 1910. That's how the oil used to come up. And this is the largest oil field in California. It's been producing for a really long time. And what's left doesn't gush. It's thick, heavy oil that has to be fracked or heated with steam. And the sheer amount of energy that it takes to extract and refine this heavy oil makes it as carbon intensive as tar sands and among the most carbon intensive oils in the world. Slide. This is Kern County today. It's not a healthy place. The American Lung Association gives it an F for air quality and rates it as among the worst in the US. It ranks near the bottom of the state in terms of health status, but is in the top 1% for things like asthma, air pollution, and drinking water contamination. Kern County residents have a life expectancy 4 years less than the state average and higher rates of cancer, chronic respiratory diseases, low birth weight, and premature births. It's especially unhealthy if you're a Latinx or person of color with a life expectancy gap between whites and non-whites, which is 3 times greater than the national average. And the closer you get to Kern's oil fields, the greater the number of people who fall in that disadvantaged category. Slide. Well, you did it. So extreme extraction methods to bring up that thick, heavy oil require large fleets of diesel-powered equipment to transport materials and blended pump fracking fluids and to make steam, which is heated by burning natural gas. All this fuel combustion adds pollutants to an air basin, which has failed to meet EPA quality standards ever since those air quality standards were created. And these are pollutants well known to cause cancer, heart and lung disease, and to increase emergency room visits, hospitalizations, and premature deaths. Now add to that the volatile hydrocarbons that come up with the oil, many of which are toxic and carcinogenic in their own right. The BTEX chemicals, benzene, toluene, ethylbenzene, and xylene, are a natural part of petroleum and are also injected into wells during fracking. They cause cancer, reproductive problems like miscarriages and low sperm counts, and developmental abnormalities. These volatile organic compounds also combine with diesel pollution to form particulates and ground level ozone, which, as we've seen with wildfire smoke, can travel hundreds, even thousands of miles, affecting air quality throughout the Central Valley. That's why 2,500-foot buffers, as important as they are, can't protect everyone from the consequences of fracking and oil and well extraction. Most air pollution in Kern is caused by cars, not oil, but oil production is a significant contributor. The 20,000 drilling permits that Kern County pre-approved over the past 5 years are adding 5,000 tons of pollutants to the air annually. And if this bulk permitting, which was stopped by court order, is allowed to resume, 50,000 more drilling permits are planned. Augmented oil extraction also pollutes water. Can you change the slide? Every barrel of oil that comes up is accompanied by 15 barrels of water, a combination of what drillers injected and highly saline water that was deep underground to start with. This wastewater contains heavy metals, radioisotopes, those BTEX chemicals, and over 300 possible additives. Some goes into open pits to evaporate, releasing more volatile toxics into the air. Over 1,000 of the pits in Kern are unlined, so the pollution actually just drains down into the soil. More wastewater is injected into disposal wells underground. The US Geological Survey has verified in 5 different California oil fields that both pits and injection wells contaminate groundwater. And this is happening in a county where 23% of residents already lack access to safe drinking water. Some oil wastewater is also used to irrigate fruits, nuts, and vegetables. Can you change slide? And we know that irrigating with wastewater can affect plant health, decreasing the expression of genes that fight plant infections. And the jury is still out on what it might do to humans. The Central Valley Water Board convened a panel of experts to look at this question in 2017. They tested wastewater irrigated carrots, garlic, and potatoes and found elevated levels of a fracking chemical associated with liver and kidney disease, strokes, cancer, and diabetes. They've also reviewed over 300 additives and 90 naturally occurring substances and narrowed this list down to 130 chemicals of highest concern. 40% of these have unknown toxicity. And that's as far as they got in 3 years. Meanwhile, irrigation continues. The attitude is, we'll keep doing it until it's proven to be harmful. Well, physicians say, don't do it unless it's proven to be safe. Now I'm going to turn this back to Amanda to introduce our colleague, Dr. Jeff Mann.
All righty, Jeff.
Many studies have compared the health outcomes of people living in close proximity to intense oil and gas well activity with the rest of the population. These proximity studies allow us to identify the toxicological risks associated with oil and gas development. These health risks have been identified: Although many of these studies did not analyze populations in California, the health outcomes do apply here, where the proximity and intensity of drilling produces a similar environment. Next slide, please. A 2020 study from Johns Hopkins found that patients living in close proximity to well drilling and fracking were more likely to be hospitalized for heart failure. Another study found increased markers of cardiovascular disease, specifically arterial stiffness and elevated blood pressure in those living near well stimulation sites. Next, please. This Johns Hopkins study of 27,000 asthma patients found a 70% increased likelihood of emergency room visits and hospitalizations in those living within a half-mile of well stimulation sites. A study of South Los Angeles residents found asthma rates among children and adults living within 1,500 feet of oil and gas drilling were significantly higher than the county average. These are some of the cancer risks found. In Colorado, there was a twofold increased risk of cancer in people living within 2,500 feet of oil and gas drilling. Childhood leukemia was found to be 4 times more likely for those living in areas of high well density. And in Pennsylvania, a childhood cluster of bone cancers called Ewing sarcoma was reported after fracking started in the area. Let's look at preterm birth studies. There was a Stanford study in San Joaquin Valley, and they found that mothers living within 6 miles of high oil activity were more likely to give birth prematurely. Preterm birth is the leading cause of infant mortality in the United States. Another California study of nearly 3 million births found women living within 1 kilometer of the highest producing wells were 40% more likely to have low birth weight babies. And this study from Texas found an increased risk of preterm birth for those living within a half mile from gas wells and increased rate of fetal death at 2 miles from gas wells. Increased risks of heart and neurologic birth defects have been found in infants from mothers living near oil and gas drilling. This study from Oklahoma found a risk for those living within 2 miles of drilling, and this study from Colorado showed an increased risk identified for those living within 1 mile of drilling. It's important to look at mental health risks as well. People living near areas of heavy well stimulation have increased reporting of symptoms of depression, sleep disruption, stress, and anxiety. And occupational health risks, it has been studied and has been found that fatality risks in oil and gas extraction are 4 to 7 times the national workplace fatality rate. It's important to point out that in addition to extreme extraction being a public health danger, it is an environmental justice issue in California. More than 3/4 of the 21,000 plus, that should be 21,000 plus, new oil wells drilled in California between 2011 and 2018 were located in low-income minority communities. People of color make up 92% of the 1.8 million Californians living within a mile of oil and gas development. 80% of students at schools located within 1 mile of oil and gas wells are non-white. And lastly, in our state now racked by pandemic, we have found that people with COVID infection who live in areas of higher air pollution are more likely to die from the disease. Next slide, please. The statistics quoted today are more than statistics to us. They are people, they are patients, they are community. These people are exposed daily to public health risks. The outcomes of the study quoted today would alarm physicians no matter what the cause. But in this case, we do know the cause. The physicians from Climate Health Now find extreme oil extraction an unacceptable risk. Ending extreme extraction is the right thing to do, and we want to help. Thank you for your attention. We're happy to entertain any questions or discussion.
And I'm gonna stop sharing my screen for this. And I see, I think Samantha as well entered who I think is from a legislator's office as well. Welcome, Samantha. Thanks for joining.
If you want to introduce yourself, we'd welcome you. Can I say thank you to Dr. Ring and Dr. Mann for a really comprehensive but also concise overview, because it's hard to pull together like a huge amount of data. And I would just add one more thing that we talk a lot about within Climate Health Now is how when kind of message testing is done on communication for around climate, what is repeatedly comes out is that when climate is framed as a health issue, that's the most likely frame to engender kind of emotions of support for action. And they haven't done it on fracking that I know of, but I think the theme is the same. And that's a really important point that we want to, you know, it's like a tool we want you to be really using, and to use our voices to amplify that, is that we encourage Senator Wiener and all the co-authors to really leverage the fact that health as an impact from fracking, health as an impact, something harmed by climate change, that this will help build the support that we need for success. So that that messaging is, you know, the research shows that that helps to build the support.
Ashley, that is one of the most important points. This is Karina Mayer. I'm also with Climate Health Now. I'm a pediatrician. And on this inauguration day, and a day where, or a time where divisiveness, that word has been used a lot, and how divided our country is and how partisan it is, health and the health effects of oil and gas extraction, combustion affect everybody. Yes, it affects people who are disadvantaged and impoverished more, and who live closer to these sites more, but it affects everybody. So it crosses party lines, and has been shown to be the most effective way to communicate the harms.
Yeah, I appreciate you both saying that, and I really want to thank the two presenters as well. That was fantastic, and I think we're well aware, Senator Wiener is well aware, as are all the co-authors, that, you know, we're going to want to be approaching this from a health-based perspective and really pushing that this is a matter of equity. This is a matter of the future of California and the health of those Californians. I did have a few questions regarding the mental health impacts. I'm just curious if, you know, Dr. Mann, perhaps you could go a bit more in depth. Do we know what was causing, is it just exposure to some of those chemicals, or is there an actual mental impact of consciously living near extraction and seeing, you know, an oil well being tapped?
I think there's a few things, and I'd be, if there's any other doctors on the call who want to answer as well. So I think part of it is that a bit of helplessness, because people who are living close to these sites, they don't, they aren't able to maybe get away, get out of, you know, their position in their situation. They're sort of a little bit helpless is part of it. You can be living in an area and all of a sudden there's a new well that's being drilled right next door. And there was, you know, a very moving talk that I saw, and it actually interviewed maybe about a half a dozen people. And again, I think this was in Colorado, that this health professional studied these people. And they just had, they felt helpless because these things were taking place right in front of them, and there wasn't anything that they could do. You know, a lot of them were not able to move from where they are. One person, you know, described and showed pictures of 50 feet from their window, this wall went up and they started drilling on the other side. So that's part of it. And, you know, a lot of this, you know, this drilling goes on all the time. It doesn't stop. It doesn't go from, you know, 9 to 5. This goes on all the time. So there's, you know, there's a lot of interruption from noise, from light. And it's just sort of a constant barrage. So I think that seems to be where a lot of it comes from. If anybody wants to add, you know, please do. Cynthia.
Thank you. Yes, Kate, thanks for bringing that up, because the mental health impacts are often not appreciated enough, and they really do impact people's lives and their hope and their future, and especially the youth. I would reinforce what Jeff already said about the issues of disruption and noise. That's something I didn't really appreciate fully until we spoke with Dr. Tom McCone from Berkeley, who is one of the authors of IPCC report, has done a lot of work in this area. And the level of noise is a tremendous stressor that can cause high blood pressure, heart disease, those kinds of things. And that and the light and the sleep disruption, we know that sleep deprivation is a major contributor to mental health issues. And that cannot be overestimated. And something that a lot of people aren't aware of is the connection between inflammation and mental health issues. We know that all of these particulate matters and toxins create a tremendous amount of inflammation. That's probably part of how COVID and pollution interact. But that inflammation can disrupt brain neurotransmitters and electrical transmission, and is undoubtedly contributing to some of the mental health issues. So it's multifactorial, but it's definitely real.
Yeah,
I don't
thank you
really
both for the
have
explanation.
extra information to add to that, but just wanted to mention I'm a psychiatrist and I work with a research group that looks at inflammation and mental illness. So
Good.
very related to these topics. I don't think I have extra information to share than what's already been said, but definitely from our research group's perspective, a lot of mental illness, or all of it, has links to inflammation, and pollution has links with inflammation. We do think that air pollution, water pollution, other pollution leads to inflammation in the body and leads to increased risk for mental illness. I think that's just one small component. I think the other things that have been mentioned are really big components too: the sleep disruption, the powerlessness that was mentioned in Stephanie Malin's work. So just to echo that, from my limited glimpse so far, it just seems really clear that there are just so many pathways through which living near fracking and having exposure to pollution would lead to significantly increased risk of mental illness.
Thanks, Adrian. I didn't know you were a psychiatrist on here, so I would have deferred to you in the beginning.
And I can also add, so there's a group called the Climate Psychiatry Alliance, which we're well connected to. And I'm curious to hear from Tate and maybe Bryn, do you have a sense for how much kind of you're going to bring into the discussion how fracking is part of the climate crisis narrative, or, how are you seeing framing that? Because I think, I can speak for myself that what brought me into the climate crisis was the safety of my daughter, and that there's no safe place in the future for anybody. And of course, the most vulnerable are harmed first, but it's not safe to live beside fracking operations now, and it's also not safe if we continue fracking for any of us to live anywhere on this singular planet. So I'm curious, what kind of conversation has there been about how much to bring together the interconnection?
Yeah, absolutely. I think that it can be sometimes difficult in concrete legislation to sort of have that overarching understanding. So we're trying to develop out some findings and declarations that typically go before the bill language that sort of just state positions like this. And so we're developing them out right now to sort of hit on that exact point that you pointed out, Ashley, and to mention, the energy intensity of fracking and other oil extraction, and how these things all sort of conflate to just worsen the climate crisis. So I would love to work with all of you to, develop out some further findings that maybe hit on that and the health impacts pretty explicitly.
Can I ask a question that follows along on that, which is, how much do we want to focus on how quickly changes could improve health? Like, we know if you decrease traffic pollution, ER visits can drop like within 24 hours. Asthma rates decrease. And has there been attention focused on that? And would that be helpful in this strategy? How do you think we should focus our efforts?
Yeah, I mean, on our part, there hasn't been that effort. We just don't have that data. But if you all are able to supply that, that'd be great. I think one of the difficult things that we'd face in terms of that is we don't have amazing concrete data when it comes to this oil extraction and production. So we have some data from CalGEM, and we're planning on submitting another inquiry to get answers from them, but they don't track a lot of this information as specifically as we'd like. So it may be difficult to actually come up with that data of saying, if we were to limit X amount of production, it would have these health effects immediately, because we don't even know what percentage we're actually limiting. But I think that, if there are any studies that we can reference or any data sets that you have of, other areas, maybe even other countries where a particular area was heavy in oil extraction and then that all sort of got shut down rather quickly, and there were any, positive health effects from that seen in the short term or long term future, if that study exists.
I can speak to two, and we will find you more, I promise. So one, which is really dramatic, was 2008 was the Beijing Olympics, and they took measures to reduce air pollution, I think through international pressure. I think they closed down factories. I think you had to drive, alternating days with your license plates. They did several different things. They seeded clouds so that they would rain to clean the air. I mean, things like that. And I know there are studies showing, even in that short period of time, I believe it was over the course of months, they decreased the frequency of premature births from months of reducing local particulate matter. And we're talking about particulate matter. So there's tons of, relevance for those kinds of things, because fracking creates so much particulate matter, like Dr. Ring and Mann spoke about. And the other thing that comes to mind, I put a link in the chat, was more recently, because of the shelter-in-place quarantine in this spring, there's at least one study I know of that showed a decrease in mortality because of the decrease in air pollution in China. And for the period that they looked at, there was actually more lives saved because people weren't dying from air pollution than lives lost from COVID. So there's a very rapid, visibility of these co-benefits that Dr. Mahoney is talking about. And we can frame those and line those up in examples. And because of particulate matter being in common, I think the relevance is high for the fracking bill.
Yeah, that would be great. I would love to see some more of that. I think it's going to be, we probably won't have, to my understanding after listening to what you said, we don't have the data to show exactly, oil halting in one area may lead to this, but just showing general changes in, air pollution or other forms of pollution from fracking would be fantastic.
I think it might be possible to look at that, though, because we have had a dramatic decrease in drilling, and we're talking about a part of the economy that runs in a boom bust cycle. So there have been lots of places in the US where there was a lot of drilling and then there wasn't. So it might be really interesting. We could get some of our epidemiology colleagues to just look at that data.
Yeah.
And there is data actually from right here in California that when the air quality policies in Southern California were implemented over a 13-year period to restrict, the air pollution for nitric oxide and PM 2.5, it was associated with sustained improvements in lung function development of children over the same period. And the same Beijing Olympics was listed in here too, and the same thing in an area of Utah where some sort of apparatus broke down so that community didn't have the pollution for a 13-month period, and all sorts of health measures improved. So there are isolated studies like that.
That sounds like a perfect example. Obviously, that sounds like some fantastic happenstance of something shutting down, and I'm glad people studied that, but that sounds fantastic.
My favorite one is the Carmageddon in LA when they shut down the big freeway, and the emergency room visits and I think hospitalizations too dropped immediately.
Shocking. Well, not shocking, but shocking that it's such short term and so impactful. Yeah, I would love if you all were willing to compile some of those sort of reference statistics, I guess would be a phrase for them, of just showing, the adverse impact on health that can be changed in such a short period of time.
I think this is less helpful in the opposite, but they have done studies about rates of everything going up during fires, which is kind of demonstrating the same thing, but in the opposite direction. Just thinking that'll be like a few extra links we can pull in.
Absolutely. Yeah, I'm sure those are unfortunately very similar to some of the effects that we'd see from fracking.
I was going to add one thing and then also see if there are other questions from staffers that we can help answer. I was just going to add, in addition, I know Dr. Ring touched on this in her presentation, but the pollution from the trucks that are required to actually run and, set up and run and make all of this happen is a huge contributor as well. So even though we're, so a lot of what we're talking about right now is, diesel fuel related air pollution, which, one could say, well, that's not directly related to fracking or oil extraction, but it actually is because of the amount of trucking that goes, directly along with these operations. Does anybody, either Tate, if you have other questions, or any of the other staffers who are on the call have any questions?
I'll defer to Samantha. I'm not sure if she's able to speak or not, but I don't have any other questions. And I just, again, want to really thank everybody for putting this together and taking the time to do this. It was really informative, and this conversation has been very productive, and I'm excited to see where we can, best use all of your amazing efforts to help pass this bill.
All righty. Well, thank you. And Tate, we have a list of things that we will get to you. Oh, Cynthia, go ahead.
Other quick question. I'm curious, Tate, and other staffers, about whether there's been a conversation about water and water shortages as they're related to using water for these extreme extraction techniques. So there's a twofold issue here, and I don't know enough about this yet, but we know that it takes a lot of water that's injected to make the steam and to thin out these very heavy, nasty oils and extract them. And then there's the wastewater that's produced that has to be disposed of. And those, I think a lot of people have them confused. I know I do,
Sure.
But I'm curious as to what you're hearing about that, and if there are things that we should be trying to get information about from a health standpoint regarding water. We talked about the wastewater that's produced, but about the water that's needed and diverted from other potential uses.
Yeah, I think that's sort of another one of those overarching things that we're attempting to put into the findings and decks. Noting the energy intensity, noting the water usage, and it is going to be, I think that it will be less tied to the actual language of the bill and more tied to our messaging, and really hitting hard that, this is taking up millions of gallons of water. And I found one study that I believe I've referenced in the fact sheet that sort of compares the water usage that was going into oil extraction during the drought that we faced a few years back, and kind of showing, is this where our priorities should be? Other people are having to limit water, and yet this industry is not being regulated in that way, and they're able to sort of dump as many gallons as they'd like. So we'll definitely be hitting that, and are definitely going to be emphasizing that. Any further information you have on sort of groundwater pollution or the effect on agriculture and crops through groundwater is, I'd love to see more of that. But yeah, we will certainly be hitting on just the quantity of fresh water that's often needed.
I think the equity issue with water is really important. I mean, the Central Valley has really severe issues with access to clean drinking water. And I mean, when looking at the statistics for Kern, it's like 23% of the population doesn't have access to uncontaminated drinking water. So it's really a justice issue.
Another related issue, I don't have the specific data on it, but once you contaminate an aquifer with these contaminants, particularly heavy metals, it's virtually impossible to salvage that aquifer. So in a state that is so water depleted and who's depleting its ground sources of water, to inject under high pressure thousands and millions of gallons of water and potentially leach heavy metals and other contaminants into the aquifers is a potential disaster for California and its populations. So the water aspects of this are massive. I think that's probably the most worrisome.
And I would just say, as a nephrologist, we know that the biggest health impact coming with climate change is heat. And the hotter it is, the more water people need and the less water we have available. So this problem is only going to become more and more pointed.
I just have a question, Tate, about, I mean, you know what happened with SB4, and they commissioned a study about the risks of fracking, and the study came out and made a number of recommendations, and then it was completely ignored. And so I guess a lot of this has to do with the power, I mean, the effectiveness of our regulatory system. And is there a way to build something into the legislation that would make it more enforceable?
Not necessarily more enforceable. So what we're working on is we're in discussion with a lot of the co-authors currently to possibly expand the bill, and that desire to expand it, I think, comes from a hope that if we were banning certain methods, that we'd be banning essentially all of them that would function. There's a worry that if we ban a few methods, that CalGEM will somehow find a way to skirt around that and either go back to those same practices under, you know, slightly different definitions, or to use other methods and just kind of start pumping those permits out, you know, and so that becomes the main form of production or extraction. So we are working with the consultant from Natural Resources Committee as well as others to really make sure that the language is as tight as possible so that there can't be those loopholes. I think that's the best way that we can make it, you know, quote unquote, more enforceable. But we are certainly very cognizant of that and of the definitions that we're using so that CalGEM doesn't sort of set up their own rules after this bill hopefully passes.
With, this is a little off topic, but has there been any progress in engaging labor?
So we've met with CTA, or excuse me, CFT, the California Federation of Teachers, as well as CNA, the Nurses Association, and both of them have noted that they'd be supportive of the bill. They have internal processes that they need to go through, obviously, but they, you know, both said they wouldn't really have an issue getting to support on this, which would be great. Those are obviously groups that are not directly impacted by this in the traditional sense. We've also talked to SEIU, another one that is less directly impacted. They were potentially supportive, although the relationship that they have with the building trades is a bit complicated. We have yet to engage with the direct labor groups that this would actually, you know, potentially impact. And we are hoping to do that as we develop out any sort of just transition language. We've included a section regarding oil well remediation. And so we're hoping to sort of flesh that out a little bit before we directly engage with those groups.
Sounds good.
All righty. Well, we are 3 minutes to quarter of. Is there anybody with a last question or a comment?
Yeah, Samantha, would you mind saying who are you? Who do you work with?
Absolutely. So I'm with Senator Lamone's office.
Okay. Thank you so much for joining.
Thanks for joining. Yeah.
Very helpful.
Good.
Awesome. All righty. Well, we will wrap things up. We have a recording of this that we'll share with you all. We want our message to get as far and wide within the legislature as possible, and we want to be a resource in whatever way we can. And there's more of us, believe it or not. So we can bring in numbers, and we are very excited to do that with this messaging of health, and this is about health. And this is also, you know, one other thing I wanted to underscore as well. This is also about the health of workers. I mean, that's, I think, a part of this that we didn't touch on in great detail, but you know, I can speak personally where I work in Richmond. I care for the children of people who work in refineries, which are obviously different from the drilling wells themselves, but there are true health consequences to these jobs as well, which we can also speak to, because everyone is our patient. California is our patient. But thank you very much. We will follow up with what you all asked for, and we are so excited to stay in touch. Please share this around, and if there are other people who weren't here who want to follow up with us with questions, I'm going to put I know Tate, you have my contact information, and then I'm just putting our generic email in the chat as well. That's another way they can get in touch with us. But thank you all so much, and stay safe. And thank you again to Dr. Mann and Dr. Ring, and to everyone who put so much work into this presentation.
Thank you. We appreciate
Thanks very much, everybody.
Thanks.
your interest.
Alrighty.
And
Have a good
thank
afternoon.
you.
Thanks.
Alrighty, take care, everyone.
Bye.